When I was younger, they didn't diagnose me until I was 5.5, which we were told is really, old for CF patients. Most are diagnosed when they're infants. And I had a lot of health problems when I was younger. Thought it was asthma, allergies. So, October 2008, my lung collapsed, and I don't know exactly what caused it, but after that, I just had lung collapse, succession. So they finally said, you need a lung transplant because if you don't have one, your lung is not going to last you much longer.
I was a smoker, even though I knew better. Okay, my mom had had cancer and she smoked, and all her brothers and sisters had had cancer. I kept on getting a bronchitis, it kept on getting worse and worse, and I had the terrible hacking cough, and the doctors did x-rays on me, and it turned out that he told me I had a COPD, which, believe it or not, I was glad because I didn't know what COPD was, and I was just happy it wasn't the cancer, so the pulmonologist back home had recommended we come down here, and we got in, and Dr. Gopher here told me I had 6 months to live, so with that we kind of, and got on the stick, and got things, and met with everybody we had to meet with, and they did all the testing that was required, and I got into the transplant program at that time.
The immune system disorder that comes with my blood disease, it caused me to catch lots of infections, and it built up my lungs, and they became very obstructed, and I had end-stage lung disease. So when we finally came up to Duke's thinking that we were going to do a bone marrow transplant, they realized that my lungs were so damaged that I probably wouldn't be able to survive a bone marrow transplant. So we totally shifted gears and went on the lung transplant route before we did the bone marrow transplant.
I hung out with my friends, just a normal college kid, and as I got more into the semester, I started getting really out of breath just walking to class every day, and it got to the point where I'd have to stop and sit down, and I'd have to take the elevator to go to my second floor classes, and I was never that bad. I was never on oxygen. I was a pretty healthy CF patient. So once I noticed I was getting worse, I was like, I really need to go to my doctor. I actually got short of breath just walking to the PFT room, and they took my pulse ox, and it was 77. My mom had talked to my aunt, who's a nurse back in Maryland, and my aunt said, listen, you should go to Duke. My mom went on the private plane with me, and she said they were doing blood gases every half hour, every hour, and they flew at a low elevation just so they could get me here. Mind you, I don't remember any of this. This is just people telling me everything that happened. Straight from there, I went to the 8th floor. They put me on a ventilator, and apparently that wasn't working. And an oscillating ventilator, and that wasn't working. And that's when they decided that I needed to go on ECMO.
Oh, the first person I met, the main person was Dr. Zaas, and I loved him. I liked him and just the information he told me about their statistics and their survival rates and everything. And I was like, this is where I need to be.
Dr. Schultz, my bone marrow transplant doctor, kind of goes by the motto that the future of medicine is custom care. And that's kind of what I felt like I was getting, that exactly what I needed. They were just kind of pulling things together from, their expertise and their specialty to create the perfect treatment program for me.
When I was in the pediatric ICU, they try to get you up and walking on ECMO, which from what I've heard is very hard to do. And I'm known as the ECMO kid because I walk the furthest on ECMO, which I find really funny because at the time I'm just like, I just want to get out of bed. Mind you, it took half hour to 45 minutes to get our whole parade of people together to walk on ECMO. One day after we walked, everyone kept telling me about this fish tank that's in the lobby on the 5th floor. And I was like, I want to see this fish tank because I'm a marine science kid. I want to see fish. Give me something to do. And so I had told my nurse, Greta, I was like, I want to go to the fish tank. And she was like, all right. So the next day, we start walking, and I was like, we're going to the fish tank. And everyone's like, yeah, okay. And we did. We made it all the way to the fish tank, and we took pictures, and everyone was amazed. And at that time, I didn't think it was that big of a deal.
I think it made me a lot more determined and probably less stubborn because I've always been a very stubborn person. And the first day that the PT guy came in to help me walk, and they had given me pain medicine earlier, and it dropped my blood pressure. So he came back after that and went off, and it was time for my next dose. I'm like, well, I need pain medicine. He's like, no, because if we give you pain medicine, you can't walk. I was like, well, I'm not walking till I get pain medicine. He's like, no, you're walking. And he's like, I was sitting here all night until you walk. You know, and in my head, I was like, well, you might be spending the night with me then. But he finally got me up and got me to walk. And yeah, I just felt better about myself. And I've always been, this person, I'll do it when I want to do it. But you can't do that with transplant. You have to do it when they want you to do it. So I think it changed me in that aspect too.
I love PT. You get to see, PT isn't just the whole living center in general. It's not just physical therapy. It really is emotional and mental therapy as well. Because I get to see all these people pre-transplant just working so hard. It amazes me. And they all come up to me and go, you're an inspiration. And I'm just like, you're the ones working your butt off. I was like, I took the fast track to get this done. So you really get to appreciate what you have now. And then I have a bunch of friends at PT that are post-transplant. One of my friends got her lungs the night before me. And it's just awesome to talk about going through the same stuff.
I came here in January of 2010 and went through the 23 days of rehab at the Center for Living with everybody else, and that's a wonderful program because they put the people who haven't had a transplant yet with the people who have had the transplant, and the ones that have not can see what's to come and can see how well they're doing and stuff, so it's just a wonderful concept. And the people that you are here with, the Center for Living, where you're with all the people who are here for transplants, you become so close. They're just like family, As a matter of fact, we all stay in touch and just had a reunion a couple of weeks ago, so that's a wonderful thing. I would not go anywhere else, and not even for a hangnail, except for here at Duke. Just wonderful. All the doctors and nurses, everybody here, it's just been top notch. I mean, it's just a wonderful place to come.
But I just like to tell everybody thank you. I don't really have a chance to tell everybody that was involved thank you. And I mean, they really changed my life. They saved my life. So I don't think they always get the recognition they deserve. And it's not just Dr. Zaas and the transplant surgeons and the coordinators. There's so many different people involved, that make everything happen. I think they all deserve, a big thanks because it takes a lot, on their part to get these people transplanted. So
everyone at Duke's fantastic. The nurses, they're all like a big family, and they're so nice, and they treat you with respect, and they listen to what you have to say. And it's not just like, oh, well, the doctor said we have to do this, because you know your own body, and they'll listen to what you know as well, which I really appreciate, because there's so many doctors and hospitals that don't do that.
The whole team, the people at the Center for Living, the doctors, the nurses, everyone, they're just really supportive, and they work together, and it's just really great to have them all on board and know ahead of time, like what doctors you're going to have and how it's going to work. They do a really good job of preparing you for everything.
It's fantastic, to be perfectly honest with you, to just keep walking and not be out of breath, because I don't know a limit for myself now, because I just keep walking. I'm like, I just keep going like the Energizer Bunny, and I'm not as tired as I used to be, and it really blows your mind.
I'll go to the gym with my roommate, and I'm like, I couldn't have done this 2 years ago. I could barely walk. And I'm in the gym, doing like hour-long workouts, and I'm at college, hopefully going to get my degree soon, and it's just, I don't really think about it, but when I do think about it, it's amazing how far I've come.
It's just a new world for me, I mean, now I can hold prior to, I couldn't hold my grandkids because I couldn't breathe, long enough to hold them. Now I can,
I just went back to school on Monday, and so I'm excited about that. I have a month left of my junior year, and then I'll be a senior. I've made varsity cheerleading for next year, and I'm in the process of running for student body president, so I hope that goes well. But I'm just, it's just so amazing that everything has worked out so well, and now all the things that everyone else is talking about, and I was just kind of like, oh, well, things like going to college and getting married and making plans and stuff like that, it's stuff that I can actually look forward to.